We owe so much to medical advancements. At the top of the list, we now have extraordinary disease treatments and cures and cutting-edge surgical techniques. Because of this, we're living longer and our quality of life can remain high until the very end. In fact, end-of-life care is now a subspecialty of medicine, helping to keep us comfortable in our last days while providing support for the loved ones who are left behind. Known as hospice, this service is the gold standard for families who are faced with life-limiting illnesses.
What hospice is really about, and this is the joy of it for me, is that it's about choices. It's about being able to do what you need to do, not what I need you to do, to have the kind of experience for whatever time you have left. So once people kind of begin to understand that it's not a typical medical model, we're a team and they're at the head of the team, then the dynamics start to shift and you'll see people start to want things. Whether it's from a meatball sandwich to going to the Bahamas. People live longer in hospice. They live an average of 29 days longer in hospice. It's because it's a step up in care.
Despite all of the benefits of hospice, it is an underutilized service. Studies show that 85% of Americans want to die at home, yet 50% end up dying in a hospital. In fact, only 35 to 40% of Americans use hospice. Janet Lieto, medical director at a hospice center in Texas, explains why it is an underused resource and how families can advocate for hospice care.
It's underutilized because most people affiliate the word hospice with getting very close to dying. Hospice as a program is designed for patients that are in the last 6 months of their life. Two physicians have to deem them terminal. Doesn't mean if you're here in 6 months the program ends. Continue to provide care to patients. People think it is a place to go, but it is not necessarily a place to go. Hospice care can be provided in the home, in a nursing home setting, an assisted living setting, and also in inpatient units around the country.
In the case of my dad and later my wife, Karen, they did not want any heroic effort to try to prolong their life just by being hooked up to machines and respirators and all of that. And so having made that decision, they had the benefit of being pain-free. The time with my dad was moving from the role of caregiver to loving son and companion. With Karen, it was moving from desperate husband who couldn't do anything because she's behind a curtain in ICU to host, literally in her room, welcoming her friends and loved ones to come in and visit with her and hold her hand and pray and do whatever we chose to do in our environment.
Among all the progress we've made in healthcare over the years, hospice is by far the most special. Experts in the field hope to see the service become more widely available to those who need it the most. For over 15 years, Community Hospice of Texas has been the largest not-for-profit hospice in the state, serving 25 counties. Depending on the patient's needs, the highly qualified hospice team will determine where care is best delivered. For families, friends, and caregivers, Community Hospice of Texas is also committed to meeting every bereavement need by providing grief counseling services for an entire year after the passing of a loved one.
We go to Waco, Dallas, Mahia, Cleburne, Whitney. We cover this really wide area now and continue to cover people who get exactly the same care, even if they don't have any insurance, even if they don't have anything, even if they don't have a home. So it's one of the things that I think has helped us grow. I think when you do the right things for the right reasons, good things happen.
And when faced with making end-of-life choices for a child, Community Hospice of Texas is ready and willing to work together with parents, pediatricians, and other healthcare providers. As one of the largest pediatric hospice programs in the state, hospice team members will do everything they can to help families continue to make memories together.
There's a time, and this is a hard time and it's different for everyone, when you say, we've done everything we can do and it's not the outcome that we want, but we're not going to get a cure. We need to bring in the experts. And the experts were the pediatric nurses through Communities Hospice of North Texas. They brought us to a level of comfort in our home where we could still be a family, we could still participate in family activities. Over a 9-month period of time, they helped us with pain management, with just navigating the system. It takes a whole village to raise a child, but it takes a very special village to help a child die. And she had a wonderful life.
At least with Community Hospice of Texas, the service isn't just directed only to the patient and only until that day of death. It continues with a loving relationship with that family as they then get back to their regular rhythm of life.
You should have somebody who can help you walk this, help the person you love walk over, make sure everybody is comfortable, give you the support you need. Our mission is to be the leader of hospice care in this area. I believe we already are, but our mission is to absolutely remain at the top.
For those who need help understanding coverage or eligibility, the experts here will help families navigate the waters of this difficult time because your life matters. To learn more, visit us online or call the number on your screen.